Hello, Lottie. How are you doing?
Hi, Dr. Ben. Good.
First of all, I want to ask you, how are you feeling today? Is today a good day, a bad day, a medium day?
Today's a good day.
Good.
Yesterday wasn't.
Okay. And so, you have been diagnosed with what?
Trigeminal neuralgia.
Okay. And so, is it affecting the right or the left side?
Left.
Or both? Left side.
Left.
Always on the left?
Always on the left.
Okay. Of the three branches, the ophthalmic, maxillary, or mandibular, which branch is primarily affected?
The mandibular, the bottom one.
The bottom one.
Mm-hmm.
Okay. Does it change or move, or is it pretty much in that one branch?
No, it's pretty much in that branch.
Okay. Any other symptoms you have besides the typical, I would assume, since you've been diagnosed with that, your symptoms are something like the electric or stabbing pain in that area of the face, which is the hallmark symptom that most trigeminal neuralgia sufferers report. Is that fair?
Yep.
Okay. And I wanted to ask you about other symptoms. So, like, do you have headaches?
All the time.
All the time. Is it on both sides or one side?
Pretty much one.
One side. What area? Can you point to it?
Right here and behind my eye a lot.
Behind the eye a lot. Okay. Is there any sensitivity to, like, sunlight with the eyes?
Yes.
Okay. Can that trigger a flare? Or is that trigger a headache, or is it just sensitive?
Just sensitive. The cold really affects it. I have problems if we take the dogs to the beach and it's super windy out. We went to Alaska, and on the cruise ship, every time I walked outside, it triggered a flare up.
Okay. So is it fair to say that you have more flare-ups in the wintertime than the summertime?
No, it's the same all year, really.
Okay. So do you have things that trigger it in the summertime other than wind on the face, like putting on makeup, brushing your teeth, any of those kinds of things?
No. I told you before, cigarette smoke kills me, and that always brings up a flare-up. Always.
Okay. What about neck issues with sore neck, tired muscles?
My neck is a mess.
Okay. Tell me about being a mess. Does it only hurt on the left side, or does it hurt on both sides?
It hurts predominantly on the left side.
Okay.
But I attribute that to sitting at a desk a lot too.
Okay.
Because I'm always down typing. Maybe.
Sure.
But.
And then what about arm and finger numbness and or pain?
My fingers get numb all the time.
Okay. Do you wake up with your fingers numb?
No.
It just happens randomly throughout the day?
Just randomly.
Is it all the fingers, or is it just like 3 fingers, or is it the thumb?
It's my left hand, and it's the tip of my left hand.
Okay. You have a formal diagnosis of trigeminal neuralgia from your PCP or your...
Two different neurologists.
Two different neurologists confirmed that. Okay. And you had an MRI?
Two.
Is that fair? 2 MRIs that confirmed the diagnosis. Okay. And medications. Are you taking medications at this time to control the pain, or are you just kind of dealing with it?
I'm dealing with it.
Okay.
I take a lot of Excedrin. I drink a lot of wine. I just deal with it.
Sure, as best you can.
As best I can.
Sure.
I was on every pharmaceutical known to mankind, and it just made me so stupid, and just, I couldn't deal with it. I can't run a corporation and be that stupid.
Sure.
So.
Sure. So it definitely affects your quality of life. That's a fair statement.
Oh, definitely.
Okay.
And my husband's.
Sure. And it affects the relationship, no doubt. Because there's a lot of stuff that he can't see that he has to deal with and help you with. And so that puts strain on a relationship, no doubt.
Yep.
So, do you ever get flare-ups when you eat?
Yes.
Okay. So, is it certain foods? Is it certain textures? Are you avoiding certain things?
I am. We had steak on Easter Sunday, and it killed me. I had the worst attack ever.
On average, where do you put your pain on a 1 to 10 scale, with 10 being the worst flare-up you've ever had and 1 being, I feel as great as I ever have, where would you be?
I would be, every day is probably a 6 or a 7 daily.
Okay.
I
And then
don't feel great.
Sure. And then when you're at your worst, where would you put that?
A 12.
Sure. Sure. Do you ever get down to low as like a 3 or a 4?
Yeah, if I work out, and I feel a lot better if I work out.
Anything that you want to add that I haven't asked?
No, I just want you to make me better.
Fair enough. What about you? Anything that you've observed, seen?
Vertigo, you talked about that. I've witnessed that before.
Okay.
The numbness of the hands is actually worse than that. It's purple. They go from a normal to almost a bright purple instantly.
Okay.
So those things are.
Do the
common.
colors, the temperature in the fingertip, does that change?
Mm-hmm.
Yeah. No.
Get colder?
Mhm.
Okay. Does it always accompany the numbness? Or do you have different temperatures in different regions of your body, usually like back, feet, hands?
I'm always cold.
Okay. But general rule, then no, like you don't have like a hot spot
No,
on one hand and then the other one's cold.
no.
Okay, all right. And then how did you find me?
My husband did. He got so tired of dealing with it. So he set up an appointment for the gamma knife procedure. The guy told me that I was too young to have it. He said it would only last about 5 years and I would have to have it again. And then I saw your video of the girl that had 2 and it didn't do anything for her. So,
Right.
you know, that's where I'm at.
Okay, and so there's no way to know what our outcome is going to be, although the success rate of this with good follow-ups is in the low 90s. And if it helps you, the trend is like it's not going to last for 5 years. Like it's there, it's good. The only caveat is I'm going to need to see you once a year to make sure that this does not change. If it changes a little bit, you're hardwired for pain. How long have you been suffering with this?
I was diagnosed when I turned 50 and I'm 58.
Okay, so you've been dealing with this for 8 years. Any questions before we start? How about you? Any questions before we start? Let's get going. So Lottie, you just had round 1 of DTR. Things feel different with your bite? Do you feel like you have a repetitive home every time you bring your teeth together? Things touch the same? Okay. Does it feel like they all touch kind of at the same time?
Yep.
Does it feel like they touch with the same intensity?
Yep.
Okay. So what you were used to was not the ideal, but you didn't know any better? This
Right.
was just your bite? Did you even perceive that the bite was off? Like
No.
at any time?
No.
Okay. So this is what really kind of gets me when doctors say, I don't need that machine, I can rely on the patient to tell me that the crown or the filling is high. I said 3 times that filling was high on the lower left, which is where I did my adjusting. Like, the dentist who put it in didn't know it. The patient didn't know it. Any questions for me about anything?
No. No. It doesn't hurt. I mean, my mouth feels more like it's symmetrical, if that makes any sense.
Yeah.
You
Makes
know?
perfect sense, because that's one of the things that we were measuring, was how much bite force on the right versus the left. And it's interesting to me, it should be interesting to you, although I see this a lot with trigeminal neuralgia patients, is your bite force was 70% on the left side, which is your affected side. So now that we shimmed up everything to where it's hitting within 5 percentage points of 50-50, it'll be interesting to see what happens as you heal and you move forward. And welcome back.
Yes.
How are you doing?
Good.
So last week we did round 1 of DTR therapy, and I called you the day after just to kind of see like how things had been.
Mm-hmm.
How'd you sleep?
Amazing. My husband wanted to videotape me, but he didn't. But usually when I sleep, I'm so restless and I toss and turn all night because my face hurts or I have a headache or whatever. But I slept like a baby, according to him.
Do you find it easier to get into a comfortable position? Okay, I hear that very frequently with sufferers. Once they've had it, that the odd little position they had to get in to get to sleep, they don't have to do that anymore. Okay, well, good. How about other symptoms like?
I did not have a headache until yesterday. So I went almost 6 days. I went almost 7 days without a headache until yesterday.
So how, refresh my memory, how often were you having the headaches?
I was taking between 4 to 6 Excedrin a day, and I pretty much had one all the time. All the time.
All right. So anything else that you've noticed? What about eating? Like, has eating been? Can you chew better? Can you open wider? Are you able to eat things that you were avoiding? Tell me about that.
No, you said you wanted me to eat something that was, so we barbecued a big old chicken, and I had that, a big old chicken breast that was the size of my head, and I ate that, and there was no problem. So
you weren't tired afterwards? Is that something that was common when you would chew prior to the therapy?
It wasn't that I was always tired, but it just wore out my jaw. I would feel, and I think that's what caused my headaches, because I felt it. We went to lunch after our appointment, and it felt so different to chew, and I felt so much better.
Sure.
So.
What about you? Have you noticed anything that?
The sleep is. I noticed the sleep right away. The sleep is sound. It's 8 to 10 hours of no waking up constantly. That was a huge thing.
That alone is going to make you feel better if you're getting good quality sleep.
As far as eating, I haven't had to restrict anything, so it's all new. Some of it's new.
Yeah.
But I haven't noticed anything after, like we used to.
Yeah. If I had something that was really difficult, like I told you, on Easter Sunday we got really nice steaks, and I just full on after that felt I had to go to bed. It hurt so bad.
Sure.
So.
All right. Interesting how the bite can play such a role in so many different of your symptoms.
Mm-hmm.
Now that the bite has been corrected and you're not running a marathon with your face all night, you're able to sleep more soundly, and that's very, very common. So I would kind of expect that to continue, and some of the other symptoms will continue to improve as time goes forward. Any questions about anything?
Nope. I just wish you weren't in Eugene and you were in Portland.
Well, I get people that say, I wish you were in Canada and not in the U.S. So, all things being relative, I'm still easier to get to for you than I am a lot of the people that watch those videos and say, I think he's onto something, this makes sense, and she has the same symptoms that I have, so would this therapy help me? Which is exactly how you guys found me, right?
Mm-hmm.
Perfect. Okay. Well, if you don't have any other questions, we're going to get going.
Okay.
I saw you last, in May?
Mm-hmm.
And it's middle of September now.
Mm-hmm. Almost end of September.
Almost end of September. You have a business and a busy lifestyle, and some things have come up.
Yeah, and normally the things that have come up would have made me have a major trigeminal neuralgia attack.
Sure.
One that I would have been in bed and been crying my eyes out. My father-in-law had a stroke.
Sure.
The day he was supposed to come to my house, he fell flat on his face and broke his nose. And had 2 strokes, actually. Broke my arm, sued my builder, just...
Big life things going on.
Yeah, big stuff. But I haven't had anything, which is amazing. The anniversary of my mom's death. I thought I was going to be in bed crying with an attack, but I was good. I cheered her on. You know.
Good for you.
I know.
Good for you, and it sounds like, just from what you're talking about, that really what was going on is, you know, a bite-related issue that affected just one side. And so
Right.
when you go in, you tell the doctor, hey, I'm feeling unilateral pain and it really hurts real bad in this area, and doctors are quick to jump and say, well,
Here's some meds. Go ahead.
sure, here's some meds, or even the diagnosis is
Right.
trigeminal neuralgia, even though it may not really be that. And so you avoided surgery, right, by trying this out, and it worked. Lo and behold, I mean, you tried it out, but we did measure, and there was a discrepancy that matched what your symptoms were. So it wasn't like we were just throwing food at a wall and hoping
No,
something stick.
no. I saw how my bite was and how it was all spiked on the side that I had the pain.
Sure.
And, you know, that Easter Sunday where I ate a steak and I was in bed the next day. I mean, I can eat anything now and nothing happens, you know?
That's awesome. Was that what you were expecting?
No. I thought, I don't know. I thought that I couldn't have a miracle and that, you know, I was just throwing money out the window. But honestly, it's the best money I've ever spent.
On your average day prior to treatment, where would you put your pain threshold, 1 to 10 scale, 10 being the worst ever, 1 being I don't have any concerns?
Oh, sometimes it'd be a 12.
Sure.
I mean, it would just, you know, and certain things, I mean, things that were so stressful would just make you, and maybe because my bite was so out of proportion, I would just grind my teeth or, you know, but it probably, my bite affected that nerve,
Sure.
which made it just amplify.
So where would you put yourself now on an average day, 1 out of 10?
I'd put myself at like a 1.5, a 2.
Okay.
I said I do get an occasional headache, but the occasional headache I get is if I don't drink 4 liters of water.
Okay.
I'm a water fiend, and so if
Sure.
I don't drink enough water, I might get a little bit of headache, or if I don't eat my lunch at a normal time, but that's not for my face. That's
Right. I mean,
yeah.
there are certain triggers that can affect that, but you're not taking medication for pain.
No.
Bottom line.
No.
Okay. All right. Fair enough. Now, have you gone back to the neurologist or to the primary care doctor?
Hell no. Going there.
Okay, fair enough. Well, I just thought, you know, I was curious to ask, like, what would the feedback be after you've said, well, look, I tried this and all my pain's gone now? Because one of the things, and it's a little altruistic on my part, in the sense that I'm trying to help as many patients as I can, obviously. But not all doctors are all that has anything to do with what I diagnosed. And if you think that trigeminal neuralgia is neurovascular compression, yeah, it wouldn't have anything to do with it. But now I'm like 15, 17 trigeminal neuralgia patients into this, and I'm sitting here scratching my head thinking, well, all of you were diagnosed with an MRI.
Mm-hmm.
All of you were diagnosed by a neurologist.
Mm-hmm.
How is it that a dentist getting the bite right fixes or greatly improves, in your case, the symptoms and the pain and the problem? Maybe there's data that's being missed, that they're making a clinical diagnosis in the absence of this data, which would lead us down kind of an erroneous path, right?
Yeah. Well, why do that and just throw medication at people? I mean, I must have been on 9 pharmaceuticals. And I mean, things that impacted my life. I mean, he puts me on this one drug and he goes, I'm going to be really honest with you, this is Topomax, but we call it Dopomax because it's going to make you really stupid. I back over my grocery cart in my brand new car. Really? I give my wrong employee the other person's bonus when I did payroll. So no, things like that affect your life and you're a zombie is not fun.
No, absolutely not. And to be fair, I don't know, aside from putting you on a table and cutting you, the only other option most doctors have is to give you medication. And it's one thing that I keep hearing over and over is, well, this isn't going to cure you, but it might make you feel a little better.
Yeah, but what is that doing to your kidneys, your liver? What is that
Sure.
doing to your quality of life? I mean, when you can't concentrate and you feel like you're a drug addict, that's not what I want, you know? So,
I don't think anybody that's having chronic pain, wants that either. Can we fix it without doing surgery? Can we fix it without medication? And what I liken this to, and it's a poor analogy, but everybody understands cars, and if your car's not running right, you can buy a brand new transmission and engine, or that's very expensive, and you have a lot of time and money invested in that. Or maybe we can just do a tune-up, and let's do the least expensive thing first, and figure out, well, if I get relief from that, then there's no reason to go on to the next thing, the more expensive thing. However, if you start out with surgery, and the surgery doesn't work, and then you start to backpedal, which I've seen in a number of cases that I've done, like, okay, well, I wish I would have done this first because it was a lot less invasive. But the reality is dentists don't really understand the enormity of how the teeth coming together can really play a role in oral-facial pain. And a lot of them don't believe it has anything to do with oral-facial pain.
well, I told you how much the surgery was.
Yeah.
Yeah. It was $100K, and he guaranteed it for 5 years. And he told me, he looked me in the face, and he says, you're a little young for this surgery. You're 58. You'd probably have to have it redone in 5 years and just keep going. So who wants to get their head cut into every 5 years? That's my game plan.
Sure. So you're glad you had it done?
Oh God, yes. I told you if I had not been at 58, I'm gonna have a child. But if I did, I'd name him Ben.
Well, I'm glad you're having the results you're having.
I am.
It's amazing.
Good.
What does your husband say?
Oh, he's so happy. He's so happy. But he's like, well, I found this for you. I do all the research, so.
You're a team. It doesn't really matter.
I know.
So you just say thank you and I'll go take out the trash.
I mean, May to almost October, I haven't had one incident. I mean, that's hitting a home run to me.